When Republicans succeeded in their effort to overturn Roe and restrict access to abortion across the country, they claimed increased investment in support for women and children was a priority. Do you want to guess how that turned out? My name is Brittany Page. This is the Page Perspective. I'm so grateful to see so many new subscribers after my last video. Thank you for commenting and sharing your stories, for leaving me voicemails filled with words of encouragement, and all of the emails. I love to see it, and so do the other people in this community that we're building. So keep commenting, keep sharing your perspectives. I want to hear them, and so does everyone else. You can follow me elsewhere at Brittany E. Page on Twitter, Threads, Instagram, and TikTok, if that's your thing. Now, you may have seen me talk about Idaho before. It's competing with other red states in the Restricting Human Rights Olympics right now. Idaho has actually come up a few times now that I'm thinking about it. I guess the first big one was the Boise police captain who was exposed as an active white supremacist, attending racist conferences and writing racist blogs. But I also recently talked about the connection between abortion bans and the crisis in maternal health care, including maternity wards closing in Idaho hospitals, leading patients to have to make lengthy treks to other hospitals to have babies. Well, this time, we're talking about Idaho's decision to implement one of the strictest abortion bans in the country, while simultaneously refusing to expand postpartum Medicaid coverage, putting an end to the Maternal Mortality Review Committee, which reviewed maternal deaths and gave recommendations for how to prevent those deaths. This makes Idaho the only state in the union without a Maternal Mortality Review Committee at this point. And they turned down $36 million in federal grants to support childcare. How's that for pro-life? This reporting comes from ProPublica. I believe they can do no wrong. And reporter Audrey Dutton, who did a deep dive into the ways that Idaho is fighting with other red states to be the worst place for maternal health care. I want to first start with Republican Governor Brad Little and what his stated priorities were once Roe was overturned and Idaho's trigger law went into effect, banning abortion. Quote, Governor Brad Little said the state should turn to helping women who might otherwise have terminated pregnancies. Quote, we absolutely must come together like never before to support women and teens facing unexpected or unwanted pregnancies, said Little, a Republican who supports the abortion ban. About 1,700 to 2,000 people a year in Idaho had abortions before the court ruling. Quote, families, churches, charities, and local and state government must stand ready to lift them up and help them and their families with access to adoption services, healthcare, financial and food assistance, counseling and treatment, and family planning. But since the June 2022 decision, Idaho has failed to deliver, even as other conservative states with abortion bans took steps to enhance their safety nets for families during pregnancy and after birth. Local and state governments must stand ready to lift up women and teens facing unwanted or unexpected pregnancies, he says. But then, nothing. The opposite of nothing, actually, actively working to strip help from the people who need it most. Let's start with Medicaid. Medicaid is government-funded health coverage that is either free or low cost for people with low income, the elderly, or people with disabilities. It also provides pregnancy-related coverage through 60 days postpartum. But states now have the option to extend this coverage because of a provision in the American Rescue Plan Act of 2021. States can now extend this postpartum coverage to 12 months. Seems like a no-brainer, right? Especially if you care about mothers and babies. Healthcare is essential, and even states like Florida and Alabama seem to get this because they have implemented the 12-month extension. But not Idaho. As you see, looking at this map, Idaho joins Iowa and Arkansas as the three states that have refused to take action on this very simple step of extending health coverage for new moms and babies. Now, what are the consequences of this? I want to turn now to a report from Georgetown University's McCourt School of Public Policy and the Center for Children and Families. Quote, only three states, Arkansas, Idaho, and Iowa, adjourned their 2023 legislative sessions without taking action to extend postpartum Medicaid coverage. This will leave about 15,000 new moms each year without a full year of coverage after the end of pregnancy. Roughly 6,000 new moms in Arkansas, 3,000 new moms in Idaho, and 6,000 in Iowa. Due to the lawmakers' inaction, postpartum moms in these states will revert back to a 60-day postpartum coverage period in Medicaid as their states return to regular renewals after the end of the COVID-19 pandemic's continuous coverage protections. Research shows this could have dangerous consequences. Before the pandemic, about half of all people covered by Medicaid for pregnancy lost coverage after the 60 days postpartum period. And national data showed that about 1/3 of pregnancy-related deaths occur between 43 and 365 days postpartum, after many have lost Medicaid coverage. But of course, it isn't just healthcare coverage. It's also cutting of funding for childcare and family support, about $38 million worth. Reading from reporting from the Idaho Capital Sun, quote, "The committee voted 17-2 to pass a budget without the Child Care Stabilization Grant. The $36 million grant from the Federal American Recovery Plan Act would have gone to Idaho child care providers between July and September. Those grants are designated for access to reliable, high-quality, and affordable childcare via one-time cash grants to help childcare providers stay in business, according to the budget request. Without the funding assistance, they expect to need to increase tuition rates, like immediately, if they want to keep their employees. Parents leaving the workforce because of unaffordable childcare would affect the economy. Working families don't have a lot of budget wiggle room at this point. So they passed a budget without the grant, which will now increase the cost of childcare, which will then prevent people from being able to access childcare in a state where abortion is banned. What was that about stepping up support for women and children post-Roe? That same committee, by the way, also cut $2 million designated for support and education for families at risk of entering the child welfare system. Specifically, that money would have offered parental resources and support and education on evidence-based child and neglect prevention programs. In response to these cuts, Governor Brad Little's press secretary said that, quote, he trusts that the Idaho legislature will put forward alternative solutions that support the needs of Idaho women and our communities. What alternative solutions? I'd love to know, Brad. Is it the alternative solution offered from Blaine Conzatti, an anti-abortion lobbyist and president of the Idaho Family Policy Center? Quote, the Bible is clear, and the history of Christendom broadly is clear, that it's the church's responsibility to meet the needs of the poor and to ensure that people have the services they need to live flourishing lives. And what happens when the churches aren't stepping up to fill that role, Blaine? When people don't have a family or a community to turn to? What happens when churches are actively working to ensure people are forced to have children they do not want and cannot afford to take care of, and then leave them to fend for themselves? The reality is that it's hard to believe these people actually care about protecting life when they're cutting millions of dollars in funding that will support parents and children, when they're saying no to extending postpartum health insurance coverage from 60 days to 12 months, and when they're dissolving the committee tasked with evaluating maternal deaths in the state in order to offer solutions to prevent those deaths. Reading again from ProPublica's reporting, no action set Idaho apart from other abortion ban states more than when Idaho's legislature allowed its Maternal Mortality Review Committee to die this year. The committee had been granted unique powers to review private health care and other records of women who died during or within a year after pregnancy and draw conclusions about the root causes of those deaths. Its budget of $10,000 a year came only from federal funds, so keeping the committee going seemed pro forma. Every single state, New York and Texas alike, had put one in place. But in Idaho, a lobbyist for an ultra-conservative nonprofit stood up and spoke against it at a hearing. Fred Birnbaum, Legislative Affairs Director of Idaho Freedom Foundation, said studying the causes of Idaho's roughly 10 to 15 preventable maternal deaths each year risked inviting a push for more government support to help keep people from dying. And government support was anathema to his group. You know the old saying, all roads lead to Rome, said Birnbaum, who testified against the committee's creation on similar grounds in 2019. Well, all government-created committees lead to the call for more government spending. You know, the reporter Audrey Dutton in this article noted that the Maternal Mortality Review Committee's final report from 2021 included 52 recommendations, and most of them did not involve a call for more government spending. But even if it did, that would simply be the cost of doing business, right? The cost of protecting life, right? Apparently not. Apparently, if you have a Maternal Mortality Review Committee, they might find that patients are bleeding to death in childbirth, and that in order to prevent that from happening, new protocols must be put in place to ensure the health of mothers and babies. And well, that's going to cost money. You know what else it would do, Fred and other anti-abortion activists? In the case of Texas, it would allow hospitals to ensure that their professionals have the proper training and education, and then it would reduce the frequency of birth-related hemorrhage deaths, thus saving life. But at least they're being honest now. Banning abortion is not about protecting life. If it were, you'd see Republicans making enormous investments in programs that do, in fact, protect life. But they're not. They are cutting those programs. They're speaking out against those programs. They're actively working to make childbirth more dangerous and lethal, and life more difficult for innocent babies. Now, all of this is bad. It's terrible. We've been in a terrible place since the fall of Roe. But even in states like Idaho, with one of the strictest abortion bans in the country, people have options. There are local abortion funds like the Northwest Abortion Access Fund, where you can donate in order to support people seeking abortions. There are also organizations like the National Abortion Federation. I actually recently, with my co-host Jesse Dollamore, interviewed their chief program officer, Melissa Fowler, on I Doubt It podcast. The National Abortion Federation runs the National Abortion Hotline, which provides fact-based information on abortion and can help people seeking abortions, whether that means finding a clinic or obtaining funding to cover the essential medical procedure that is an abortion. But they also help with funding the travel necessary to get to a clinic for that procedure, including hospital stays or plane tickets. This organization is essential, but their services cannot be used unless people know that they exist, and unless organizations like this are financially supported and able to do their work. When Roe fell, there was a wave of rage giving, which was great, but that support has slowly leveled off. So these organizations need your support now more than ever. So I'd encourage you to join me in donating to a local abortion fund, or you can look right below this video and donate to the fundraiser for the National Abortion Federation right here. YouTube covers all transaction fees, so 100% of your donation goes to the organization. They have a 4 out of 4 rating on Charity Navigator, so you can rest assured that your money is actually going to do good. I think I'm going to end it on that note, because even if this story overall isn't positive, we should feel hope that there are people out there, people like you watching this, people who care about what's happening in the world and want to do the work to change it, whether that means organizing, voting, donating, or spreading the word. What do you think? I'd love to know. You can call 657-464-7609. You can leave a voicemail, or you can email idoubtit@dollamore.com. You can support my work on Patreon, patreon.com/idoubtitpodcast. Remember, you can connect with me on TikTok, Instagram, Twitter, and Threads at Brittany Page, and share this video with someone you think needs to hear it. Thank you for being here, and I'll see you next time.